This is Dr. David Stoker, board-certified plastic surgeon in Marina del Rey, here to talk to you about BOTOX and Dysport. These are two of the most popular medications in aesthetic medicine these days. They become so commonplace, it's almost like getting your hair done to go get BOTOX and Dysport. There are some very important reasons for that. Reason number one is they work. Reason number two, almost everybody can benefit from them. Reason number three, the risks are very low. And reason number four, although they're not cheap, they're not nearly as expensive as surgery or other procedures. All of those have made them wildly successful in helping patients to shave years off their appearance, to delay the appearance of frown lines and other undesirable characteristics on their face, to delay the progression for wrinkles that will require more extensive surgical procedures. Obviously, it's important not to overdo these medications. You want to go to somebody who has an artistic eye with the BOTOX and Dysport. You want to make sure that you start out conservatively. Don't be excessive in the first treatment. It's reasonable to do a more modest amount at first and come back after a week or so when it's totally set in and reassess. Tweak the dosing a little bit. Make sure your provider takes careful notes on where and how much they have added to your brow or your crow's feet or your glabella in this area. The BOTOX is very similar to Dysport, but some patients will prefer one or the other. From time to time, we encounter patients who don't achieve as much benefit as we would expect from one or the other of those medications. Frequently, by alternating with the other medication, those patients are still able to benefit from these minimally invasive treatments. The BOTOX and Dysport are complementary to other minimally invasive treatments. Frequently, fillers will be something that we'll do at the same time, such as filling in the little tear troughs in these areas where you can develop dark circles under your eyes, filling in the little creases that can develop here if you didn't start the BOTOX early enough, filling in the little marionette lines or nasolabial folds, and sometimes filling in the lips slightly, although please don't do too much when it comes to the lips. In my practice, we have very strict rules emphasizing natural appearance. I do these injections as well as my physician assistant and nurse injector. They're extremely common. Almost everybody can benefit from them starting at a young age. In addition to making you look better right away, it actually delays the aging process. So there's a significant benefit long term as well. The benefits of a BOTOX or Dysport treatment typically last 3 to 4 months. Even if you can't afford or can't squeeze in the time to get that treatment every 3 to 4 months, it's still valuable to you even if you do it just a couple times a year. So if you have any more questions about BOTOX or Dysport, feel free to call our office. We'd be happy to answer your questions, and hopefully someday I get to meet you in person. This is Dr. David Stoker, board-certified plastic surgeon from Marina del Rey, California.